A warm welcome to you on the program Your Health, reaching you from the stables of BCA 88.1 FM Umuahia. My name is Chinez Arem Abakuru and I'm standing in for Nkechi Nwoko. Today on the program, we shall be talking about female genital mutilation. You know, female genital mutilation was observed a couple of days ago, not just in Abia State, but all over the globe. And we want to talk about female genital mutilation and cutting. To do justice to this to this topic, is our guest, the Director of Public Health, Ministry of Health, Abia State, Dr. Princess Ori Agomo. You're welcome.
Thank you very much. It's a pleasure to be here.
So let me begin by asking, what is female genital mutilation and cutting?
Okay. Female genital mutilation and cutting is any procedure whatsoever that involves the removal of the external female genital organ or any form of injury to that part of the female anatomy that is not for medical reasons. That's what female genital mutilation is.
Before now, we used to hear female genital mutilation, but recently we now hear female genital mutilation and cutting. What's the essence of that cutting that's been added?
Okay, so the two terminologies are basically the same, but the cutting was added for description's sake, just to describe it better, and also for in order to include every other type of female genital mutilation. So there are basically 4 types. Okay. So we want people to understand that it's not just when the external genitalia of the female, the girl or the woman is removed that you say that this practice has occurred. So any other form of injury, whether it's cutting, an incision to that part of the body, pricking, scraping, whatever other kind of injury that is inflicted to that part of the body is also an aspect of female genital mutilation.
Okay, so what are the advantages of female genital mutilation?
Female genital mutilation is a brutal act. It has no benefit whatsoever, be it medical or otherwise. It's actually a violation of the human rights of our girls and our women. So it's a barbaric act. It has no importance whatsoever. Or benefits whatsoever.
Okay, if that is the case, why is it that our mothers, our grandmothers, great-grandmothers indulged in it so much? And even today, you find a number of females who would say they would insist that their children would undergo that process.
I think what we're dealing with here is just basically ignorance. Okay, so there are a lot of erroneous reasons that are given, but these, all of them, none of them is of benefit actually. For some people is their tradition. Do you understand? A rite of passage into adulthood or womanhood. So it's a tradition, it's a culture that they want to, they want to see that it continues being observed, not because it's of any benefit. Okay, and then for some others, they say this is how you get a girl child not to be promiscuous. Mm-hmm. For others, they say this is how a woman will be able to pleasure the husband in marriage. Mm-hmm. And so many reasons, but none of them justifiable, actually.
In fact, because of what you just said, I just remembered a story I heard a few days ago on this female genital mutilation and cutting. Someone said, so a lady who lived with them, underwent the process. I think it was about 12, 14, 15, thereabouts. She had to undergo the process and all of that. But then, after a few months, they realized she was pregnant. So if it's supposed to keep someone from being promiscuous, I wouldn't know how effective.
Definitely doesn't. I think it even has the opposite effect. Because when you cut off the aspect of the female genitalia that has feeling, The tendency is that, this person keeps hearing that this act is pleasurable, but this person never gets that feeling. That sensation is totally cut off from her because of this procedure. And so the tendency is that she seeks after it. And so she keeps, jumping from one person to the other, trying to get this feeling. So I would think it has the opposite effects rather than what is portrayed to actually do. It does not stop promiscuity in any way. It doesn't. I would say it has the opposite effect rather.
Okay. Is this practice just indigenous to the Igbos?
No.
Or
It's
Nigerians?
not. It's actually a global practice. Okay, so in some other parts of Africa, except Nigeria, it is practiced. For some South Asian countries, some Mediterranean countries, is actually practiced. So it's known that about 200 million girls have undergone this practice globally. So it's a global practice to an extent.
Okay. Now let's talk about the disadvantages of female genital mutilation and cutting.
So there are many disadvantages to the practice. Some immediate, some of the effects are immediate. Some of the bad effects are, there has a prolonged period of time that the survival actually goes through the consequences of that practice. So for the immediate effects, some of the bad effects of this practice, for the immediate effect, you have something like very severe pain. So this practice is normally carried out by some very elderly women in the communities.
And you just wonder, why is it that women are always the ones inflicting pain on
themselves? It's culture, it's tradition. Do you understand? Sometimes there's no justifiable reason. It's just that this is an act that's been going on over the years. They did it to my grandma, they did it to my mom, and if I don't do it, I'm not seeing it. Especially when it's a rite of passage into adulthood or womanhood. You feel if I don't do this, then there is this stigmatization of somebody that it wasn't done to. So you'd want to make sure that your child also undergoes the same practice. Okay, and so they will now take these little girls, mostly aged between 14, and are women within the childbearing age group, 15 to 49. These are the ones that normally undergo this practice. Okay. Yes. So they will carry these children to these old women into society that have no medical background, do not know anything about anesthesia. So they will use this local cutting instruments. Most often there is no form of sterilization whatsoever. And then they go ahead and cut off. There are basically 4 types of FGM. You have the ones where they just cut off the upper part of the female genital, external genitalia, remove the part that is known as the clitoris. Sometimes the second type, they cut off the inner cover, the inner lip of that part of the anatomy of the woman. Then the third type is where they cut off the outer covering of the female genital, external genitalia.
The labia.
And then the labia minora is type 2, labia majora is type 3, and in type 3 sometimes they even sew up that aspect. Sometimes they think they are beautifying it. They think they're making it look better. But the actual truth is that by the time they are through, the place looks very, very unsightly. Sometimes they sew it up, and then the vaginal opening is just left with a little hole. And that's where all the complications that follow the practice, that's where all that complication comes from. When they close off that opening and is no longer, and then they will inflict pains on this child. The child tends to bleed so much because they don't know how to stop bleeding, as would happen in a normal medical setting where surgeries or such it's not right for any medical practitioner to indulge in FGM. It's a criminal act. Okay, it's very unethical. But normally during surgeries, you know how to stop blood flow. But these are women that have no medical knowledge, and so they inflict this wound, and sometimes there is profuse bleeding, sometimes even to death, where they are not able to control the bleeding. So severe pain, excessive bleeding, and of course infection. Like I said, some of these instruments are not sterilized. So by that method, you now, so many of these girls will contract all sorts of diseases, including HIV, hepatitis, all these bloodborne diseases. And there's a lot of sharing of sharp. They use it for one person and then like that. So there is a lot of transmission of disease from one person to the other in the process. Okay, and then of course sometimes because there is no form of anesthesia, these children or these women have to be restrained, and there have been occasions where there were fractures to bone, dislocation of the joints, just as they're trying to restrict them and to carry out this practice. So there are immediate effects, then there are long-term effects. For example, on childbearing. Now, when you inflict wounds, normally wounds will heal with scarification, and therefore the elastic nature of that place is lost. Sometimes the vaginal opening is sewed up so that, plus this scarification, the keloids are formed there, and now the narrowing of that opening, childbirth complications will now set in because there will always be prolonged labor. These women find it difficult to now give birth naturally. So most often they have to undergo cesarean section to be able to have their babies. Some people have a lot of pains, during menstruation because that hole is now, so the opening is now so small, and the menstrual blood builds up, creating pressure and a lot of pain during normal menstruation. So a lot of pain, chronic pain, and then of course I've talked about infection. There is prolonged labor, and this can sometimes lead to fissures. Fissures are now opening between neighboring organs with the uterus. So you can now have a tear that will cause an opening or a passage between either the uterus and the bladder, and that will cause what we call VVF.
Okay.
Vesicovaginal fistula. And so you see these children always, or these women always dripping urine, because of that opening there, a passage between now the uterus and the bladder. Sometimes the opening is now between the uterus and the rectum. So you now have them also, from their private parts, they will now be bringing out stool. So these are some of the things that women go through. Some of them, a lot of childbirth complications in childbirth that can sometimes lead to the death of the child and the death of the mother. Then, of course, you have the psychological and mental effects. Some of these children are filled with anger. When they realize that, these women, they are filled with anger in their hearts, a lot of fear for the wound or, the pain that was inflicted on them, all the difficulties they pass through in childbirth, during menstruation, the constant and the chronic pain, the fact that they cannot even have the normal sensation during sexual relations and all that. So all these things are a resultant effect of this practice. You have people that have gone into depression, anxiety, and one thing that is known is that depression is a killer. So you can have cases of even suicide. Do you understand? Just because of this act that is totally useless, that has no benefit whatsoever. So these are some of the effects of this practice, and this is why we need to stop female genital mutilation and cutting. It does not do anybody any good. It's a violation of the human rights of the girl child and the woman. Okay, it's a form of discrimination against the the women and the girls in our society.
Okay, I wanted to ask, is it possible for this female genital mutilation to be reversed?
No.
For example, in the case where some parts of the genitalia are sewn up, is it possible?
Well, when you finish doing the cutting, wounds will heal by scarification naturally. So some of these things are irreversible. They are totally irreversible. Most of these physical, aspects or complications are irreversible. There might be some medical procedures to aid childbirth. For example, I've talked about, having to go through cesarean section for childbirth. But once there is scarification, and you cannot reverse it. So most of these complications are actually reversible. So once done, it is done. And that's why we need to stop the act. The practice.
So now, talking about this act and the effects it has on the women who undergo it or who are made to undergo it, because I want to believe that many women will not want to undergo this if they had a choice or if they had an option. Is there something that your ministry, the Ministry of Health, is doing to sensitize the people, or at least to reduce the this practice?
The much you can do is advocacy. You try to improve the knowledge, people's knowledge. Okay, so advocacy, awareness campaigns, those are basically the things you need to change attitude, the attitude of our people, to understand that there are no benefits to this procedure or this act, and therefore encourage them. Advocacy to the opinion leaders in the community, our elders, so that they can enforce, change in norms and practices in the community. Awareness to ensure that there are laws. Okay, so but you need to bring it to the awareness of the people that this practice is wrong, this practice is criminal, is discriminatory, is a violation of the human rights of our women. When you bring that knowledge to them, you encourage them to change their attitude. So that's basically all you can do, apart from giving support, psychological support to the survivors of this practice. Okay, a lot of psychotherapy and counseling for the survivors, and then if there are medical complications, ensure that the women that have undergone this practice give birth in the hospitals, so that if complications arise, they can be arrested on time, so that you can preserve the life of the baby and the life of the mother, as it were.
Okay, talking about the laws, are there penalties?
Yeah,
for this FGM, and
it's actually a criminal offense. So there are laws in Nigeria, laws in Abia State against it. The lawyers will speak better on this, but there are actually laws, both jail terms and fines for those who perpetrate it, those who encourage the perpetration, and all that. I know that one of those laws is the VAT law.
Yeah.
Okay. And for that, I know there are such penalties as jail term, 2 years, fine penalty of 200,000 for those that perpetrate it, and then those that encourage the practice can get they can get like 1 year jail penalty and a fine of 100,000. So it's a criminal act that is penalized under the law of Nigeria and Abia State.
Also, dear listener, you have heard it's a criminal act. In case you encourage it, you aid it, or you're one of those who enforce female genital mutilation and cutting, it's a criminal act, and if you're caught, you will go in for it. Now, let me ask, how easy is it for people who are victims of FGM and C to own up, come out and say, I am a victim, I need help? In the course of your profession and your practice, how easy is it?
The truth of the matter is, in a society such as ours, these things are actually, they are not things that, you see people coming out to easily open up on because of our kind of society. These things are shrouded in secrecy. Do you understand? Even the survivors most often do not come up to say, I am passing through this. And that's why you have cases of depression, cases of anxiety. So, but I know that we have structures in place. We have social workers, I know they have social workers that they can actually open up to. Okay? We have psychotherapists that they can open up to get the needed support. Okay? To get the needed support, and to ensure that they are able to overcome the consequences of this act.
Okay. So where can these social workers, psychotherapists, where can they be found? Because someone listening might be a victim, or might know someone who is a victim. And the person, like you said, in a society like ours, people don't find it easy opening up to say, I have this problem. They're afraid of stigmatization, what people would say, and all of that. But someone listening or watching might want to know where he or she can find help.
All right. We have social workers in the Ministry of Women Affairs. Okay. So that structure is already in place there. So I think anybody that wants can get support, can get help from that ministry. And then also in our hospitals, we have psychotherapists, we have psychiatrists who also have a professional training to handle cases, that all these mental health issues, depression, anxiety. So they can also get help from our hospitals.
Okay. So can you speak to a woman or women listening to us now who have issues of VVF, complications in childbirth, who have had complications in childbirth, who have issues with their menstrual cycle as a result of female genital mutilation in cutting? Can you speak to them?
Okay, so for such women, what they need is medical help, and these are available. VVFs can be repaired surgically, okay, and these are available in our hospitals, especially the tertiary institutions. So for a person,
federal medical centers
and
teaching
hospitals, yes, and even some of our general hospitals, do you understand? You can actually get help at such places. So I would want to encourage our women, especially those that have unfortunately had to undergo this practice. I would want to encourage them. One thing that is rampant in our society is home births, TBA births. I would want to discourage this, especially for these ones, because this set of people will not be able to handle the complications that might arise. So I want to encourage such a woman to seek medical help. Do you understand? Don't just lock it up inside and passing through this pain. For some of these things, there are help. You have surgical repairs, like I said, of VVF. So they should seek help in our medical facilities.
Is it possible that FGM and C could tell on a couple's marriage?
Oh, definitely. One of the complications or the consequences of FGM is pain during intercourse.
Okay.
So you see that there are a lot of, and that brings up a lot of problems in marriages. You understand? Where this woman does not even want to have any form of relation with the husband, sexual relation with the husband, because of the pain she feels every time she has sexual relations with the husband. So there are that, and then where a woman is depressed, where a woman is anxious, where a woman is passing through chronic pains, there are this also having problems, conflict in marriage, resultant effects, from those. So yeah, it can affect relationships in different ways.
So how could they handle it?
Counseling.
Okay.
Counseling, psychotherapy. Do you understand? And if there are medical repairs that can be done, that also. So basically that.
Okay, I guess our time will not permit us to continue, but it's been quite enlightening talking with you on this program. Well, dear listener, you've heard it all. If you want more, well, I think you might need to get to the hospitals, get to the clinics, and ask questions. And of course, you will receive answers. It's on that note that we'd like to thank you so much for being a part of today's edition of the program Your Health on BCA. I'd like to thank you so much and ask that you step out and own up and seek help where necessary. If you find someone who is in need of this help, make sure you encourage the person with what you have learned today. Encourage the person to find help. There is always a way out. I'd like to thank our resource person today. That's the Director of Public Health, Ministry of Health, Abia State, Dr. Princess Ori Agomo. Thank you so much for coming.
It was a pleasure being here.
My name is Chinese Rem Awakuru, and I wish you the very best of today. Bye for now.